Hello, this is Dr. Joe Adragna, Montrose County Medical Advisor to the Public Health Director, and this is your Montrose County COVID-19 update for April 20th, 2021. Let's jump right into it. We're going to talk about an update to the state public health order that came out. This ends the current dial as we know it. It changes face covering requirements across the state, and there's changes in occupancy limits. So first off, face coverings. The dial is removed by the newest public health order, and for those communities that have less than a 35 per 100,000 1-week cumulative incidence, then face mask requirements are very limited, and essentially they caught up with the mask use waiver that our public health director authorized when Montrose County went to then level green on the dial over a week ago. However, just as a reminder, masks are still required in preschool through grade 12, public areas of state government, congregate care facilities, including nursing homes, prisons, jails, all of your medical settings, including your doctor's offices, personal services, and limited healthcare settings. But in terms of occupancy limits, there really is none except in limited cases. So if you have more than 100 people gathered in a room in a public indoor space, then those settings may operate at 100% capacity, not to exceed 500 people, but still are required to have 6 feet distancing required between parties of unvaccinated people or when vaccination status is unknown. And in most situations, it's going to be unknown. So basically they're saying, hey, you can operate at 100% capacity, but don't encourage less than 6 feet of separation. What that means for most of the county businesses is that you can operate at 100% of your normal occupancy limit. There are some limitations that they define here, such as these rules are not applicable to places of worship and associated ceremonies, not applicable to retail services, not applicable to restaurants that have sit-down dining and do not have unseated areas where 100 or more people could gather, such as dance floors or common gathering areas, and school proms and graduations. Then there are more specific and alternative regulations around proms and graduations. But in general, if you operate a business in Montrose, there are no occupancy limits that you have to follow. Let's turn our attention back to prevention as we normally talk about this. In general, I would encourage you to get vaccinated to protect yourself, protect your family, and protect your community unless you have a contraindication to that vaccine. So, who's eligible for vaccine? Just as reported last week, we are in what the state calls phase 2, and that means anyone ages 16 and over can receive the vaccine who does not have a contraindication to the vaccine. Remember, your ages are 16 and older for Pfizer and 18 and older for Moderna or Janssen. Many of you have heard that the Janssen vaccine was placed on hold last week. They are likely going to restart that later this week after ACIP, CDC, and FDA review safety data. This presentation is not going to be an in-depth look at my opinions about the Janssen vaccine, but I am still very confident in the Janssen vaccine, and I would not have placed a hold on this vaccine. I think it is a safe vaccine, and the rates of clotting that they're worried about are exceedingly low and likely no more than background clot risk. And so I would encourage my patients to continue to receive this vaccine, and that the risk of the virus still outweighs the risk of this vaccine. So I have confidence in it. Let's see what ACIP, CDC, and FDA say after they have their meetings later this week. But in summary, we expect them to restart vaccination with Janssen. There may be some additional education around that to providers in the treatment of those clots, or there could even be some age limitations that are placed on the approval. So more to come after those organizations meet. Now on to local county vaccine efforts. There will not be a county vaccine clinic held this week. However, you have many options. Those are shown here. You can also find a list on MontroseCountyJIC.com. There are several clinics across the county that you can receive COVID-19 vaccination from, so please seek them out if you are in need. When we look nationally, we see that 211,581,309 total COVID-19 vaccinations have been administered, with 132 plus million people receiving at least one dose. That's nearly 40% of the U.S. population having received at least one dose. And when we look to the population greater than or equal to 65 years of age, 43.8 million doses have gone out, and that equates to 80.1% of our population greater than or equal to 65 years of age. When we look at the population greater than or equal to 18 years of age, we're looking at 50.7% at almost 131 million doses. And when we look to fully vaccinated rates, we're looking at 25.7% of the U.S. population. That's just over 85 million people. And when we look to our high-risk group, generally age associated at the greater than or equal to 65-year range, we're looking at 64.9% fully vaccinated. So a really good number to see. When we look at the state data, we see that additional clinics and vaccine providers continue to be added to the list, now at 1,322, with 2.36 million Coloradans with 1 dose of vaccine and nearly 1.5 million Coloradans with full immunization. We have a total of 3.7 million cumulative doses administered to this point. When we look at vaccine administration, of course, there has been a reduction because Janssen was put on hold in last week. So if you look at the right part of that graph, we see an overall reduction in the number of vaccines that have been administered. My concern is it also has put a brake on people's interest in receiving Pfizer or Moderna vaccination. So we see an overall reduction in vaccines, more so than just the losses from the Janssen, but not terribly much. When we look on Montrose County and our region, Montrose County is showing 24,664 vaccines administered to our county residents. And of course, our county vaccine team has vaccinated people that are from out of county, so I appreciate their efforts in doing that. When we look at our county, and our region, actually, we still see that more females are receiving the vaccine than men, and we see that most of these vaccines have still gone to those who are at our higher risk populations, which is good to see. When we look on the amount of vaccines that have been distributed to Montrose County as a percent of state population, we do see that we have fallen into the negative territory. This is the first time since state has been releasing this data on a weekly basis that Montrose has fallen into the negative territory. Now, we believe that we were initially in the negative territory, but that got rectified, and it was after that point when this graph started to be created for us. But we have slowly gone down in our percentage of doses distributed, and at this point, I don't expect that to change. I think that this is going to be dependent upon the vaccine uptake rate. And because there are vaccines left on the shelves at the end of the week because of decreasing demand, there have been less distributions to our area. So how many people in Montrose, or another way, what percentage of our eligible county population has been immunized with 1 or more doses? In Montrose, we're at 41.4%. So 41% of those eligible to receive at least 1 dose. Remember, that's excluding people that are 15 years of age, for example. So only those that are age appropriate would be counted here, and that number is 41.4%. When we look at the percent of eligible county population that's fully immunized, Montrose is at 34.9%. This is actually a pretty good number. If you think about it, a county of size of around 42,000, 43,000 people, and 34.9% of those eligible are fully immunized. When we look on data, we see that the dial representation is no longer there. So previously on this slide, I would show you what the dial status is for all the counties across the state. The dial's gone, so now that visual representation's gone. So there is no more greens and blues and yellows as your marker on the dial. It's simply that current public health order that says from CDPHE, you're either above or you're below that 35 per 100,000 population level. However, the state is still reporting 1-week cumulative incidence, 2-week cumulative incidence, and other data points that the dial used to track. And so this does look familiar to you, I hope. The 1-week cumulative incidence rate by county. Montrose is shown here in blue because we just barely spiked above that 35 mark, and we see the same thing in Mesa. We see deltas moved into the yellow, and along with Gunnison. When we look to this graph, we're looking at percent positivity in the last week. So what we're showing here, we're in blue, so we're still less than or equal to 5% of tests being submitted have come back positive, and we'll see what the actual number is here in a moment. But the takeaway here is if you look down to our partners in the South, San Miguel, they have seen an increase in their 1-week percent positivity. If you'll recall, I'm not a huge fan of this metric. I know it's been endorsed by the World Health Organization, but this is so manipulatable by community interest in testing, community access to testing, whether it's being ordered for those who actually show signs or symptoms of the disease, or whether your community is simply doing surveillance testing. And so I don't hang a whole lot of weight on this result, but Montrose is still in the blue. If we look to the numbers of days with decreasing or stable hospital admissions, this actually, I think, does carry more weight. Montrose has remained in the blue category here, and we look to Delta and Mesa, they're in yellow, and we hope that, of course, that trend reverses and they see fewer admissions and hospitalizations for COVID and get back to a decreasing or stable level. But we will see periodic ebbs and flows here as this pandemic continues. Now, when we look to last week, there was an actual dial report. So you see Montrose County was shown here with 30.4 on its 1-week cumulative incidence, and at that time we were in the green section of the dial. We last week had a 1% average positivity, and we had 14 days of declining or stable hospitalizations. This week we show a 1-week cumulative incidence of 42, so that's up from 30 last week on a 1-week cumulative incidence. Remember, that's per 100,000, so it's 42 per 100,000 population. Montrose, of course, does not have 100,000 people in it. It has about 42,758. It's been the number that I've been using for the last year to measure for. And our percent positivity has gone to 1.6% from that 1% last week. Our declining or stable hospitalizations has remained at 14, however. So let's look at the hospital census. If we look at that, this graph, we see two data points. In gray, we see rolling 14-day new cases per 100,000. And we see that that has pretty much leveled off. There is going to be the ups and downs here, but to the right part of the graph, you're seeing almost a flat gray line. Now below that, you'll see the black line, which is your total COVID positive and persons under investigation census by day. And you see we've had many days with 0, and then we've had a couple of days here where we had 1 person in the hospital with COVID. When we look to our model, the model is shown here in dark blue. Yellow shows you the actual hospital census for COVID positive patients. This excludes PUI or person under investigation. And we do see there's been a couple of 1-day census marks here in the last week since reported to you, and but still staying very low in census. When we look to our community around us, and let's say we take a smattering of counties, this graph represents what their prevalence has been, and there's a few takeaways here. So first, if you look to those counties that have a red bar graph, you see that is represented by Delta, Montrose, Mesa County, Gunnison, and San Miguel County. So of these counties represented on here, those are the counties that had an increase in their 14-day cases per 100,000 compared to last week. This is also adjusted by population. So this is 14-day case counts per 100,000 population. So remember, if you see a column here and it's taller than another county's column, that tells you that there's more community prevalence. So for example, Delta is on the upswing with cases, and their community prevalence is higher than that in Montrose, assuming that you have equal testing rates, which is probably not a good assumption to make, but in general, we would assume that Delta likely has a higher community prevalence of COVID-19 at this point. Of course, that's not forever, and we hope that that comes down, and certainly hope that Montrose does not go up, but things can change quickly. Montrose does show a slight increase from last week, but it's 82 per 100,000 in the last 14 days. It was 73 last week. When we look to Mesa, they're on the upswing to 143, and Gunnison just up a little bit from last week's report at 212, and then we look to San Miguel County up just a little bit from last week at 171. Overall, though, when you add up all of these counties' new cases in the last 14 days, we actually see a reduction, slight reduction in the total number of new cases. When we look to the West region, that's more narrowly defined. This is defined by the state as Delta, Gunnison, Montrose, San Miguel, Uray, and Hinsdale. We see that our 3-day average daily incidence is on the incline, and that is representing a growing number of cases. So I just told you that in the last slide we see a reduction. So what's going on here? Well, there's a few things. One is, remember, this is more narrowly looking at just a few of the counties. Hinsdale also wasn't represented on the last slide, and this is also looking at 3-day daily average and not necessarily 14 days. However, if you go back 14 days on this graph, overall we are going up. Now, are we going up every day? Yes, at this point we're still going up every day, but the rate of change, the amount that we're going up every day, seems to be slowing down, and that's represented in the red line. As it comes back to 0, that means that we're hitting a flattening in our case count on a 3-day average, and then as it goes back to green like it was in early March, hopefully that happens soon, we then would expect there to be a falling number of cases. So let's talk about variants for a moment in Montrose. Last week we reported that we did have one type of variant known in Montrose. That remains this time. We do have the UK variant here in Montrose with 5 cases now, up from 4 last week. And that's the B117 variant. Now there are other variants that the CDPHE folks are tracking, like the South African variant, the California variant, and the Brazil variant. You can look through the different counties that I've listed here. There has been growth in the number of counties affected by some of these variances. Fortunately, Montrose at this point is only experiencing the UK variant, but it's likely that we will see other variants as time goes on. As stated last time, I just want to point this out. The CDC says, quote, so far studies suggest that antibodies generated through vaccination with currently authorized vaccines recognize these variants. This is being closely investigated and more studies are underway. Meaning the vaccine works against the variants as we currently know them. Okay, when we look to the 7-day average of COVID-19 cases in Colorado, we do see that there has been a recent decline statewide in the number of cases on a 7-day average. We're down from a recent peak here in the earlier part of April. When we look at the state as a region, we see that this graph reflects that it is going down on a 3-day average, and the bottom graph shows you that that rate of change is in the negative, which is what you'd want. That means it's coming down. So we've got several data points here confirming that we do see decreasing case counts. And like at this point, it's likely to continue, and we will continue to see fewer and fewer cases at the state. I expect our region will follow, and will probably be 1 to 2 weeks behind the state report. When we look to hospital demand, we can see that on this slide. So the bottom right graph is showing you currently hospitalized patients. We do see that there is an upswing here. Remember, hospital census tends to lag behind cases. So if you see cases going up this week, you'll probably see hospital census go up next week, and then it will come down after you see a reduction in cases by another week or 2. So we're seeing an upswing here in hospital census. We likely will see that start to fall next week or after next week, and then go down as cases fall. If we look to the top left, we're seeing acute care bed use. We're up 1% on a 7-day average from what I reported last week. And on the top right, you're looking at ICU bed use. That's up 2% from last week on its 7-day average. And that, friends, is our report for April 20th, 2021. Wish you guys a happy April. Stay safe. I will report next week to you all for a community update, and we'll go through cases at that time and any changes in public health orders. And I suspect that will likely be the last regularly occurring community update in this format. And you'll still be able to gain additional data through MontroseCountyJIC.com and, of course, through CDPHE's website. Even though we won't necessarily be doing these community updates in this format on a regular recurring basis, your public health team will continue to follow the data on a daily basis and react to any changes that are necessary. But to us, this is a good sign that Montrose County is well positioned with low-level community prevalence, good education, good access to vaccine and interventions, and we think we're going to have a much better 2021. So thank you for everything that you've done as being part of the solution during this terrible pandemic, and wish you nothing but the best for 2021. Thank you.